The Mfuleni municipality says it is investigating the matter. Now, load shedding can be uncomfortable and highly inconvenient, but when someone is ill, as we've just been hearing, relying on medical technology, then rolling blackouts can in fact be fatal. Let's get an update from the ground now, because of course we've been following healthcare in Gauteng, specifically. Professor Adam Mohammed is a doctor at Charlotte Maxeke Hospital. He joins us now. Thank you for being with us. Prof, what are you experiencing?
Thank you so much for having me on your show, and good evening to your listeners. And thank you for highlighting the issue of rolling blackouts on the healthcare system. And it's actually causing disastrous effects. It's just not the immediate effect. We're losing lives. We're playing catch up from COVID, from all the operations and cancers that we couldn't deal with. And remember something, let me give you an example. A machine and a battery on an intensive care ventilator can only work for so long. You increase the hour, you increase the number of blackouts, and using that battery, that lifespan decreases. That nurse or doctor has to manually ventilate the patient. For how long does that go on? And patients are dying. Can you imagine in a neonatal ward where temperature is so important, ventilators are so important, you don't have access to that? And there's been a strong plea to the government from healthcare workers to give exclusion to the healthcare hospitals that are dealing with these patients. And every time the power goes off and on, we're damaging equipment. And we know the state of infrastructure, equipment in the healthcare system is in such a shambles and disaster. This is a nail in the coffin. And it's unfathomable how patients are suffering just from a simple thing as food. You can't give patients food because you have no electricity. And I'm sure the entire South Africa would stand up and say, we will take the hit, let the hospitals have electricity. And it's a plea from every healthcare worker to say, protect the hospitals. I know there are many essential services, but nothing comes close to a vulnerable patient, a vulnerable child who is ill, who can't actually get care because electricity is not being supplied to the hospitals. Yes, many hospitals have generators, but they can only do so much. And what's happening now is no matter how much servicing we're doing, we just can't keep up with the damage being done to equipment. CT scans, MRIs, patients, operations, heating, it goes on. And from a human aspect, we are playing with the lives of people. And it's just not getting better. It's actually getting worse in the healthcare system. And patients are dying. Surgeries are being cancelled. Operations are being cancelled. People are being denied access to basic healthcare. People are being denied access to food because of electricity. And I know it's hard out there for the entire of South Africa with this electricity issue. But I think from a healthcare point of view, we can make an exception to the rule, and I'm sure the majority of South Africans will easily say to the president and the ministers, take it easy on the government, on the hospitals. Let's give them electricity to look after the vulnerable.
Yeah.
Mr. Mandela would never allow this.
Professor, I think so many people would agree with you. You're talking about people who are being kept alive by medical technology, in some cases small kids. There's a constitutional right to healthcare in this country. So you're saying that's not being realized right now?
I think it's actually a gross human violation of what is happening. And the Constitution is very specific about under 6 and pregnant ladies and healthcare on that aspect. And that human rights is being denied, and it's a violation of the Constitution. We can talk about adults and healthcare and a progressive realization of healthcare. But for the most vulnerable, which is children, I think we are denying the rights according to the Bill of the Rights and the Constitution of this country. And I'm urging all citizens to stand up and fight for the hospitals to be excluded from load shedding. And I know we're all taking the hit, but hospitals need to be excluded because without electricity, we don't even get water. We don't get heat, we don't get steam, we can't sterilize. It's like shooting in the dark with your eyes closed. It's potluck. And we need to stand up and tell the minister, the premiers, whoever is listening to us, please exclude the healthcare facilities from load shedding. It can be done. Nothing is impossible if you put your mind to it. Right now, I think we are guilty of killing people and giving them subhuman service. And I'm embarrassed by what is happening currently to the most vulnerable of our patients.
Even before stage 4 and stage 6, Gauteng hospitals were talking about huge strain. Some people couldn't speak out, but problems were emerging, very big issues. You are a colleague of Dr. Tim Meyer, I think is how you say it, from Rahima Musa. He was suspended, then unsuspended. We were told that the National Health Department had intervened and had been concerned. Since that incident, are people in your profession becoming braver, do you think, to speak out?
I think in the country, lots of more healthcare workers are speaking up because we're speaking as one voice. So if you're going to suspend one, you have to suspend many. But I don't think the problems at Rahima Musa are resolved. There's still a lot of subtle intimidation and victimization. You've broken a soul, and there's still no reflection from the minister, from the premier and the MEC about who was accountable for such a bad act. Nobody has taken responsibility for that. So we're sweeping it underneath the carpet because we try to victimize a doctor. And there still has to be accountability for that. Who made that decision? He did a thing and he did it factually and he followed the rules. He had the integrity to stand up, and you suspend him because you're saying unprofessional conduct becoming of a doctor. And it's embarrassing that we haven't had any solid response for that. But as usual, there's always a lot of ducking and diving in the Gauteng Health to take accountability and responsibility. We still have not seen what has happened to those doctors, to those staff that were in the Department for Infrastructure and Development that were suspended for last year, delaying CMJH getting open. What has happened to that? We still have not seen the fire report. So there's so many uncertainties, so many question marks, that's beyond our control.
Yeah.
But I think I'm making a personal plea, and it's not only about Gauteng. This electricity issue is affecting hospitals across the entire country. And right now, we are not meeting the goals and requirements of our constitution. When we developed in 1994, we said we will make this place better. We're not going better. We're giving worse healthcare than what we did 10, 20 years ago. And everybody has to take accountability and responsibility. Starting from me, I can do better. That's where we need to start. Can we do better? And all I'm saying is keep the lights on. Like Dr. Tim Meyer said in his letter, give us some water, give us electricity so that we don't spread infections. We're feeding people. Can you imagine we're talking about giving someone a warm glass of water, someone a blanket so they don't freeze to death in a hospital? That's what we're talking about, basic necessities in a healthcare institution. Just think of this as your mother or father asking for a glass of water, but you can't even see where the patient is.
Yeah,
our equipment is breaking down. Let's help our healthcare workers and our institutions and our patients. I'm asking South Africa to stand up and say, please give my piece of electricity to the hospitals. Not in our name do we want to kill any more people.
Professor Adam Mohammed, thank you very much from Charlotte Maxeke Hospital tonight.